Hello, thank you for the opportunity of sharing our work with you this morning. I'm Aisling Higham, Associate Medical Director at Ufonia and also an ophthalmologist based in the UK. So I'm sure many of the clinicians sitting in the audience are familiar with the idea of having multiple conversations with patients, feeling like you're repeating yourself over and over again. This is where the idea of Dora, our product, was born. Dora is able to automate those routine clinical conversations that clinicians around the world have day in, day out. As an automated conversation, we're able to deliver a highly standardized, high-quality conversation at scale. Dora can call an unlimited number of patients at any time of day or night. What's key with this is that that means that the highly trained clinical professionals don't have to do all the routine conversations and can focus on those patients that really need their expert care. Using Dora is simple, both for the patient and the hospital. For the hospital, they add patients to a clinical list, just like they would for a normal consultation. For a patient, they receive their call from Dora at a specific time. It's on a usual telephone. They don't need any special devices or apps or even any written literacy. And they have a conversation just like they would have done with their clinician. After all the calls are complete, the hospital receives a summary of the call outcomes, which they can review. So far, we've focused on using Dora in the cataract pathway, primarily for post-operative follow-up. Dora has already spoken to 1,000 cataract patients. And what that's shown us is a huge improvement in operational efficiency. So previously, when nurses were having to do 100% of the follow-up calls, this is reduced by over 50%. We've also shown this is a safe and accurate device to use in real practice with no serious adverse events recorded. And in fact, this is something that the patients also want, which is key to any digital technology. When asked, how likely are you to recommend this service to a friend or colleague, the most common response patients give is 10 out of 10. And this is cataract patients with a mean age of 76. We're in the position where we have contracts agreed across the NHS, mainly in the cataract conversation space, but also in other conversations we offer. We're currently working with NHS, who've commissioned us to use Dora across the region, and we're doing a wide-scale evaluation of this. So I think using this technology is really very exciting. We already have the ability to use Dora in multiple languages. We have an excellent relationship with Professor Neutz here, validating the use of Dora in Dutch, and also have collaborations in Hong Kong and Toronto. We're developing Dora from the point of not just for post-operative conversations, but actually across the whole cataract pathway, from the point of triage to preoperative assessment to the longer-term outcome measures and post-market surveillance with patient-reported outcome measures. And we can do this at scale. So we've recently received some funding from both US and UK-based investors, which essentially means we have the opportunity to share this work with more of you. I'd welcome any questions you have. Please come and speak to me afterwards, or you can contact me on the email below, and we'd happily talk more about this. Thank you.